Hello, I'm Dr. Chang-Il Yoon from UNI Clinic Mokdong. Today, I'll introduce ELLISYS Sense, also known as Sense Kiss in Europe. I'll demonstrate a combination treatment using ELLISYS Sense with JUVELOOK eye. ELLISYS Sense is a microneedle RF device developed by CHUNGWOO Medical. It features vacuum-assisted technology and dual-depth needle delivery. Dual-depth RF delivery provides more precise depth control in a single treatment. Among the various microneedle RF devices I use, the vacuum feature is its greatest advantage. Skin shifting during needle penetration used to be my biggest concern with needle RF. The vacuum stabilizes the skin, allowing the needles to reach the intended depth accurately. Patients also feel more secure because the treatment area is firmly stabilized. ELLISYS Sense is often used for upper eyelid tightening and eyelid lifting. In Europe, it's also known as Sense Kiss because of its gentle vacuum-assisted contact. Even before JUVELOOK eye, I had already been using regular JUVELOOK, hyperdiluted, around the eyes. JUVELOOK eye is a collagen stimulator specifically developed for the periorbital area. I didn't have any major issues, but I was always concerned about nodule formation in thin areas like the under eyes. With JUVELOOK eye, I can perform the treatment much more confidently. The particles are much smaller than before, around 20 micrometers. Unlike the previous product, the particles are close to the threshold of macrophage phagocytosis. Because of the smaller particle size, the risks of nodules and granulomas are expected to be much lower. Previously, I often used eye thermage around the eyes. It stimulated collagen well, but tightening and lifting were somewhat limited. ELLISYS Sense with suction technology has helped overcome those limitations. Needle RF improves tightening, pigmentation, fine lines, and pores. Adding JUVELOOK eye helps restore volume and creates a more complete result. Let's take a look at today's patient. Although she's lying down, you can see mild fat bulging under the eyes with volume loss beneath it. These marked areas are where volume replacement is needed. JUVELOOK will be injected into these areas today. The remaining areas will be treated with ELLISYS Sense for tightening and lifting. We'll also treat the forehead and scalp line to lift the eyelids, brows, and forehead. Before the procedure, the patient washes the face, and we apply topical lidocaine cream. We leave the anesthetic on for about 15 minutes. Since ELLISYS Sense can also treat the eyelids, lidocaine can be applied over the closed eyelids when needed. As long as you keep it out of the eyes, there are no special precautions. Let me explain today's procedure. JUVELOOK eye is usually diluted with 2 to 4 cubic centimeters per vial. Today, I prepared a 4 cubic centimeter mixture. I first make a puncture with a 25 gauge needle. Then I perform the injection with a 25 gauge cannula. Next, I'll use ELLISYS Sense. Once the tip is attached, the corresponding settings are activated. You can choose either auto or manual mode. I usually prefer auto mode. Selecting the 25 pin tip loads the preset parameters. I usually make small adjustments from those presets. The display shows 2 treatment lines. The first line is for the first RF shot. Since the needles deliver RF twice, the first row sets the first RF depth, and the second row sets the second RF depth. Since we're treating the eye area today, I adjust the depths using the arrow buttons. The first depth is set to 1.0 millimeters, and the second to 0.8 millimeters. For the eyelids, I reduce the depth to zero point 0.8 millimeters and zero point 0.6 millimeters. One unique feature of ELLISYS Sense is the duty setting. In simple terms, duty controls how RF energy is delivered in pulse waves. Adjusting the duty allows more precise energy control than changing the RF level alone. The energy level can be adjusted using either the arrow buttons or the slider. I personally prefer using the arrow buttons. You can also adjust the interval between shots. For beginners, I recommend starting with a 1-second interval. As you become more experienced, you can shorten the interval to reduce treatment time. Today, I'll use a zero point 0.3-second interval. I've already marked the treatment areas, and I always do this with the patient sitting up because gravity changes the anatomy. While the patient was seated and looking upward, I identified the fat pads and marked the areas with the greatest volume loss. Since I'll be using a cannula, I marked the puncture site for the most direct linear access. Around the eyes, bruising is common if bleeding occurs, so I choose a puncture site slightly farther away in the fat layer. I'll begin by anesthetizing the puncture site. We use lidocaine, but we also use tumescent anesthesia. Although it causes temporary swelling, patients usually find it less painful than lidocaine alone. I'll make the puncture now. You'll feel the cannula passing through. Are you okay?
Yes,
It feels a little tight here, right?
yes.
I work in the subdermal layer, keeping the depth deep enough that the cannula isn't too visible beneath the skin. The puncture site is usually the most uncomfortable part. In patients with fibrotic tissue under the eyes, the cannula may pass with a snapping sensation. That sensation can sometimes surprise or concern patients. A vibration device or cooler can help, but keeping the procedure efficient is often the best way to minimize discomfort. Since JUVELOOK flows easily, I apply gentle pressure and hold briefly after injection to help prevent backflow. Let's move to the other side. I'll administer the anesthesia. I'll make the puncture. Around the eyes, I minimize needle insertion whenever possible. This helps reduce the risk of bruising. The trade-off is that patients may feel a little more tightness during insertion. You'll feel the cannula passing through. For regular JUVELOOK volume, I use a larger cannula. I typically used a 23 gauge cannula. Since JUVELOOK I has much smaller particles, clogging is less likely, so I use a 25 gauge cannula. It depends on the patient, but for generalized hollowing, I use a linear fanning technique. Because the product spreads easily, it's important to avoid pooling in one area. Instead of injecting continuously, I recommend distributing it as micro droplets. Since this patient has an eye bag, I injected linearly beneath it, and I explain it to patients as squeezing toothpaste in a straight line. If bleeding occurs around the eyes, firm pressure for about 1 minute usually stops it. At follow-up, many patients have little or no bruising, so I routinely use compression even if it takes a little longer.